So today we'll be talking about the musculoskeletal section 3, which covers 3 different bones, which is the scapula, which is your upper backbone, your humerus in your arm, and your arm muscles and your forearm muscles. And we'll start with the scapula, which is also known as the shoulder blade. And the 3 muscles associated with that are the serratus anterior, levator scapulae, and the trapezius. So the serratus anterior is located on your sides and kind of like under your armpits towards your back. It attaches to the medial border of the scapula and to ribs 1 through 9. So the actions of this muscle is that it pulls the scapula forward towards the chest, and it also elevates the shoulder. So think of when you're like throwing a punch, that motion there is done by the serratus anterior. The next muscle is called the levator scapulae. This is on the back and sides of your necks here, and its attachment points are the transverse process of C1 through C4 vertebrae, which is up in the back of your neck here, and the medial border of the scapula, but it's closer to the spine than in the serratus anterior. So the actions of this is that it elevates the scapula and it inferiorly rotates the shoulder and laterally flexes the neck. The next muscle that we are talking about with the scapula is called the trapezius. This is located on your neck and back from your occipital bone down to your mid back. But it's so big, so it's divided into like 3 different sections: the superior part, the middle part, and the inferior part. So the superior part is located at your neck and the upper part of your scapula, so kind of like right above here, and attaches to your occipital bone, to C1 through 6 vertebrae, so on your neck again, and the medial border of the acromion process of the scapula. Its actions are that it elevates the scapula and extends the neck, and it supports the arm. The middle part of the trapezius is located across the top of the scapula, so it's like a straight line. And so the attachment points are C7, T1 through 3, and the upper border of the crest of the scapular spine. So that's this blue section here. Its actions are that it retracts the scapula, and looking at the direction of the fibers, you can see how that would happen, how when you constrict it, it goes towards the spine. The inferior part of the trapezius is located at the bottom of the scapula down to the mid-back. It attaches to the spinous process of T4 through 12 and the upper border of the crest of the scapular spine. So that's this red section here. So it rotates and depresses the scapula, or it makes it kind of go down. So now we're moving on to the humerus, and that has 4 muscles that we'll be talking about. So it's the pectoralis muscle, our major, latimus dorsi, deltoid, and the rotator cuff. So the pectoralis major is located on the chest. It's also known as pecs. It attaches to the clavicle, the sternum, costal cartilages of the ribs, and the greater tubercle of the humerus. The movement of this muscle is an adductor and rotation of the humerus at the shoulder. Think of things like push-ups and other exercises like that. Next is the latissimus dorsi. This is located on the back, and it attaches posteriorly. It attaches to the spinous process of T7 through T12, ribs 9 through 12, the iliac crest, and then it anteriorly attaches to the intertubercular groove of the humerus. So it comes up around like down here. So its actions are the extension of the humerus at the shoulder, adduction of the shoulder. So think of things like pull-ups and anything like that. The next muscle is the deltoid, and this is also divided into 3 regions. So it's a thick triangular muscle that's located on the shoulder. So it's kind of right up here. So there's the anterior part, which is the front part, the lateral part, which is kind of like the middle, and the posterior part, which is towards the back. So the attachment points of the anterior part of the deltoid are the clavicle and the deltoid tuberosity of the humerus. So all of these points of the deltoid attach to the same spot on the humerus, just kind of in different sections of it. But the action of this muscle is that it immediately rotates the humerus and flexes the arm at the shoulder joint. The lateral part of the deltoid is this middle part here. It attaches to the acromion process and the deltoid tuberosity, and it does shoulder abduction and shoulder flexion. And the posterior part of the deltoid attaches to the scapular spine, and then the deltoid tuberosity, that's this purple part here, and it does lateral rotation of the humerus. Okay, next we're going to talk about the rotator cuff. This also has 4 muscles that all kind of work together to move the shoulder and the humerus. So there's the supraspinatus, the infraspinatus, the teres major, and the subscapularis. So the supraspinatus is a cylindrical muscle that sits in a depression from which its name originates and attaches to the supraspinous fossa of the scapula and the greater tubercle of the humerus, and it's right here, but kind of like in between these bones. And then the infraspinatus, a triangular muscle that sits in a depression from which its name originates. It attaches to the infraspinous fossa of scapula and greater tubercle of humerus. So that's this big one here that's towards the back. Then the teres minor is, again, it's anterior, so it's towards the front. It's flat and small triangular muscle and attaches to the lateral border of the scapula and the great tubercle of the humerus. And the last one is a subscapularis, which is a flat triangular muscle that's kind of like right behind the ribs and attaches to the subscapular fossa and lesser tubercle of humerus. Okay, next we're going to be talking about the arm muscles. So those are the bicep brachii or biceps, brachialis, and the triceps brachii or triceps. So the biceps attach at the supraglenoid tubercle and coracoid process of scapula and radial tuberosity. And its actions are flexion of the elbow, and it also elevates the shoulder because it attaches across the elbow and across the shoulder, so it can affect both. The brachialis attaches anterior to the humerus and the ulnar tuberosity, and it's a flexion of the elbow because it just goes over the elbow. And the triceps attach the infranucleoid tubercle, posterior humerus, and olecranon process of ulna. And it's an extension of the elbow joint, but it also does some actions on the shoulder because it does go over, it crosses that as well. So then the 2 muscles of the forearm are the flexor digitoris profundus, a fairly thick, flattened, cylindrical muscle on the anterior aspect of the forearm. So that's on the front. And then extensor digitoris on the posterior aspect, so that's towards the back. Or this, my bad. Anterior, posterior of the forearm. So the flexor digitoris profundus attaches at the proximal 3/4 of the ulna and distal phalanges of digits 2 through 5, and its actions are flexion of the fingers, hands, and wrist. And the extensor digitorum attachment points are lateral epicondyle and distal phalanges of digits 2 through 5. And that's also extension of the finger. It's the extension of the fingers and extension of the wrists of the wrist. So you can kind of figure out how everything goes with like looking at its attachment points, what's it cross, and all that. And that's how you figure out which action that muscle will be able to perform. And then also to help you study them, you can make charts like these, and then do the scapula just to help organize your information. So you do muscle, location, attachment point, and action, and just keep it all together for you to study easier. Just like you did with the hip. The humerus, same thing. Arm, same thing. And then the forearm. And then that'll help you just keep all of them together and all of your information organized. And just here's some references for the pictures. Thank you.